Understanding and dealing with chemicals, particularly in the workplace, is something America's healthcare professionals have been doing for years. Some 32 million workers are potentially exposed to hazardous chemicals on the job each year. Chemical exposure can cause and contribute to a number of serious health problems, including cancer, heart ailments, damage to the central nervous system, kidneys and lungs, burns and rashes, and sterility. Some chemicals may also be safety hazards and can cause fires and explosions and other serious accidents. In order to protect workers from the potentially harmful effects of hazardous chemicals, OSHA, the Occupational Safety and Health Administration, issued the Hazard Communication Standard. This standard requires that the hazards of all chemicals and drugs imported into, produced, or used in the U.S. are evaluated, and that this hazard information is passed on to affected employers and exposed employees.
So when the alarm goes off, the first thing...
A safety officer must be appointed to manage the hazard communication program. In large practices with 50 or more workers, a safety committee of 3 to 5 people may be used to assist the safety officer. Who is covered by the standard? All personnel, including part-time and temporary employees involved in any aspect of handling hazardous chemicals or drugs. Examples include physicians, nurses, housekeepers, and employees involved in receiving, transport, or storage. Office workers who encounter hazardous chemicals and drugs only in isolated circumstances are not covered by the rule. Compliance with the standard involves creating a written hazard communication plan that outlines how employee information will be distributed and how training will be accomplished. The standard describes the requirements for labels and other forms of warning, such as MSDSs, Material Safety Data Sheets, which we'll cover in more detail during this program. Here is how a facility creates a hazard communication program. The chemical and drug manufacturers and importers must evaluate the hazards for each chemical or drug they produce or import. Using that information, they must then prepare labels for containers and more detailed technical bulletins called MSDSs. Using the labels and MSDSs provided by chemical and drug manufacturers, employers must develop, implement, and maintain a comprehensive written hazard communication program. The employer must identify and list hazardous chemicals in the workplace, obtain MSDSs and labels for each hazardous chemical and drug, communicate hazard information to their employees through labels, MSDSs, and formal training programs, provide appropriate personal protective equipment or PPE such as gloves, goggles, and aprons to protect employees from exposure, provide medical services and first aid where the eyes or body may be exposed to injurious corrosive materials. Make this written hazard communication program available to employees. To begin the program, the safety officer must make a list of all hazardous chemicals and drugs in the facility. The list may be compiled for the workplace as a whole or for individual work areas, depending on the size of the facility. The responsibility for determining whether a chemical or drug is hazardous lies with the manufacturer or importer of the product. You may rely on the evaluation received from these suppliers through labels on containers and material safety data sheets. The best way to prepare a comprehensive list is to write down the names of chemicals and drugs in your facility that have a label indicating a potential hazard. A chemical is considered hazardous if it is labeled as flammable, explosive, eye irritant, requires well-ventilated area, carcinogenic, corrosive, sensitizing, and target organ affecting. For example, proside glutaraldehyde is considered hazardous because it is labeled as harmful to the lungs and is an eye irritant. The Hazard Communication Standard covers chemicals in all physical forms: liquids, solids, gases, vapors, fumes, and mists, whether they are contained or not. Also, think about substances generated in the work operations, such as vapors or dust, as these may be covered too. The Hazard Communication Standard applies to pharmaceuticals that the drug manufacturers have determined to be hazardous and that are known to be present in the workplace in such a manner that employees may be exposed under normal conditions of use in a foreseeable emergency. Hazardous drugs are defined as those that could cause genotoxicity, which results in damage to DNA and thereby may cause mutation or cancer. Carcinogenicity, which causes cancer. Teratogenicity, capable of causing fertility impairment or fetus malformation. Serious organ damage or other toxic manifestation at low doses in experimental animals or treated patients. Examples of common drugs considered hazardous are ribavirin, vincristine, fluorouracil, mitomycin, tamoxifen, methotrexate. Drugs that are in solid final form for direct administration to the patient, such as tablets and pills, are exempt from the standard. This exemption would also apply to tablets or pills that are occasionally crushed, if the pill or tablet is not designed to be dissolved or crushed before administration. Other exemptions include over-the-counter drugs and drugs that are intended for personal consumption by employees, such as first aid supplies. A hazardous chemical list is used to record each hazardous chemical and drug found in your facility. The chemical name and brand name. The target organs affected by the chemical or drug. The personal protective equipment to be used when handling the chemical or drug. What it's used for. The manufacturer's name, address, and phone number. And check whether or not an MSDS is on file for each hazardous chemical and drug in the facility. Purchasing records may help you identify hazardous products in your facility. Chemicals and drugs that are labeled as health hazards may cause measurable changes in the body, such as decreased pulmonary function. These changes are generally indicated by signs and symptoms in the exposed employees. Employees are considered to be potentially exposed if they are subjected to a hazardous chemical or drug in the course of employment through any route of entry, such as inhalation, skin contact, ingestion, or absorption. Employees exposed to such hazards must be aware of the change in body function the chemical may cause and the signs and symptoms that may signal that change. Here are the target organs that hazardous chemicals and drugs may affect. Hepatotoxins, chemicals or drugs which produce liver damage. Signs and symptoms: jaundice, liver enlargement. Nephrotoxins, chemicals or drugs which produce kidney damage. Signs and symptoms: edema, proteinuria. Neurotoxins, chemicals which produce their primary toxic effects on the nervous system, such as the brain and spinal cord. Signs and symptoms: narcosis, behavioral changes, decrease in motor functions. Mercury is an example of a neurotoxin. Agents which act on the blood or hematopoietic system, decrease hemoglobin function, depriving the body tissues of oxygen. Signs and symptoms: cyanosis, loss of consciousness. Agents which damage the lungs, chemicals which irritate or damage pulmonary tissue. Signs and symptoms: cough, tightness in the chest, shortness of breath. Reproductive toxins, chemicals which affect the reproductive capabilities, including chromosomal damage and effects on fetuses. Signs and symptoms: birth defects, sterility. Cytotoxic drugs are examples of reproductive toxins. Cutaneous hazards, chemicals which affect the dermal layer of the body. Signs and symptoms: defatting of the skin, rashes, irritation. Eye hazards, chemicals which affect the eye or visual capacity. Signs and symptoms: conjunctivitis, corneal damage. Ethylene oxide, a commonly used sterilant, is an example of an eye hazard. Potential signs and symptoms of occupational overexposure for a specific chemical or drug can also be found on the material safety data sheet. Each container must be clearly labeled, tagged, or marked with the identity of the hazardous chemical it contains, along with a hazard warning appropriate for employee protection. Labels must be legible, in English, and prominently displayed. The hazard warning can be any type of message, word, pictures, or symbols that provide at least general information regarding the hazards of the chemical and the target organs affected, if applicable. This is a bottle of glutaraldehyde. If it is poured into another container for use, a label must be prepared for that container. The label information must include the brand name, the chemical name and strength, and the dilution of the substance, if any, along with the name, address, and emergency phone number of the manufacturer. Under hazard warning, include target organs affected. In this case, it's lungs and eyes. This label includes additional information on personal protective equipment because goggles, a face mask, a gown, and chemical-resistant gloves must be worn when pouring, stirring, or mixing the product. When labeling containers, don't write directly onto the container. Use a label like this one, and then cover the label with a clear waterproof tape to prevent the writing from smearing. For materials that are not in their original container, a legible photocopy of the original label is acceptable. If the hazardous chemical is intended for immediate use by the employee who transfers it into a portable container, the portable container does not have to be labeled. Household products such as window cleaner and whiteout are not considered hazardous as long as they are used in a manner and quantity that the manufacturer intended for the product. Since they are not considered hazardous, MSDSs are not necessary. With hazardous products like drain cleaner or bleach that can be purchased in a grocery store, it is suggested that an MSDS be ordered even though it is not required by OSHA's hazard communication standard.
Dr. Valentino, the OR, please.
Hazardous drugs must have specific label information that can be easily read by the employee. This is the label for vincristine sulfate injection. It is considered hazardous because it is labeled as a teratogen. Once your survey of hazardous chemicals and drugs is complete, make sure that every container of hazardous material is properly labeled and that you have an MSDS for each item on your list. If not, order an MSDS from the supplier, manufacturer, or importer and document that you have requested the MSDS. This list of hazardous chemicals and drugs will serve as an inventory that should be updated as new chemicals and hazardous drugs are purchased. As new MSDSs are received, they should be given to the safety officer or other designated person responsible for obtaining and maintaining MSDSs. When a chemical or drug is no longer used at the facility, you might want to remove its name from the list and place the MSDS in a file. MSDSs describe the hazardous chemicals' physical and chemical properties, physical hazards such as flammability, health hazards such as irritation, lung damage, and cancer, routes of exposure and exposure limits, precautions for safe handling and use, emergency and first aid procedures, spill, leak, and disposal procedures. Each MSDS must be in English. There are MSDSs for hazardous chemicals as well as hazardous drugs. This is the MSDS for a hazardous chemical, Wavicide 01. Under product identification, the manufacturer's name, address, and phone number are listed. The chemical is also identified by its product name and a description. Section 1 lists shipping data, such as regulations for transport, along with emergency contact phone numbers. Section 2 details hazardous ingredients and identity information, such as the chemical components and active ingredients. Section 3 provides the physical and chemical characteristics which include the boiling point, vapor pressure and density, as well as the appearance and odor of the product. Section 4 lists fire and explosive hazard data. For example, flash point and flammability limits do not apply, but there are instructions on extinguishing as well as special fire and explosive information. Section 5 is reactivity data, such as stability, incompatibility, and precautions to be taken in handling and storage. In Section 6, the health hazard data, routes of entry into the body are listed. Health hazards, signs and symptoms of exposure, medical conditions aggravated by exposure, and emergency and first aid procedures are detailed. Section 7 outlines precautions for safe handling and use, such as steps to be taken in case of a spill, as well as waste disposal methods. And Section 8 lists control measures, such as respiratory and ventilation safeguards and the required personal protective equipment. This is the MSDS for vincristine sulfate injection, a common cancer treatment drug. Section 1 lists chemical product and company information with the manufacturer's name, address, and emergency phone number, the common and chemical names of the product. Section 2, composition and information on ingredients, tells employers the exposure guidelines. Section 3, Hazard Identification, details the physical properties of the chemical, as well as the routes of entry, and the potential signs and symptoms of occupational exposure. Section 3 also contains a helpful emergency overview. Section 4, First Aid Measures, explains how to deal with exposures to the eyes or skin, or by inhalation and ingestion. Section 5 has information on firefighting measures. Section 6, Accidental Release Measures, covers how to handle a spill. Section 7, Handling and Storage, provides the temperature range the product should be kept within. Section 8, Exposure Controls, Personal Protection. This section addresses the PPE that should be worn when handling vincristine. Section 9 is Physical and Chemical Properties. Section 10 is for Stability and Reactivity. Section 11 provides toxicological information. Section 12, Ecological information. Section 13, Disposal consideration. It gives guidelines on waste handling procedures. Section 14 lists transportation information. Section 15 details regulatory information. And Section 16 lists other helpful information, from exposure limits to regulation information. Employees are not expected to memorize information in the MSDS, but they are expected to know where to look to find critical information, such as the hazards associated with the product, the signs and symptoms of occupational overexposure, and the proper PPE to use when handling the product. Copies of the MSDSs for hazardous chemicals in a facility must be readily available to employees during each work shift. Most employers keep the MSDSs in a binder in a central location, and others computerize the information and provide access through terminals. As long as employees can get the information when they need it, either approach may be used. The employees must have access to the MSDSs themselves. When a container of hazardous chemical is received, make sure that it has been properly labeled. Your suppliers are required to send you a properly completed MSDS at the time of the first shipment of a new chemical. If the supplier forgets to send an MSDS or provides you with an MSDS that is obviously inadequate, with, for example, blank spaces that are not completed, request an appropriately completed one and document the request. If your request goes unanswered, contact your local OSHA office for assistance in obtaining the MSDS. The safety officer must make employees aware of the dangers of hazardous chemicals and drugs before handling them. Employees must be trained at the beginning of their employment, before their assignment to an area, or when they are reassigned, when a new hazardous material is introduced into their workplace, and when safe handling and emergency procedures are modified. OSHA does not require employers to maintain records for employee training, but many employers do in order to monitor their own program to ensure that all employees have received appropriate training. Mercury produces dangerous vapors that should be avoided. With the cleanup kit, such as this one from Lab Safety Supply, you can neutralize the dangerous aspects of the mercury spill. Follow the manufacturer's instructions by wearing a protective vapor mask, approved gloves, and goggles. In this kit, mercury sponges are provided for small spills. The sponges, which are coated with HG absorb powder, should be dampened with water before they are used to absorb the mercury spill. You can increase the absorbing capacity of the sponges by sprinkling more HG absorb powder onto the sponge. As the sponge is wiped over the spill, the mercury is absorbed onto the sponge, creating a silvery layer of amalgam on the sponge. After the cleanup, the sponges should be placed in the plastic bag provided in the kit and then disposed of in accordance with your local and state regulations. For larger spills, the HG absorb powder should be sprinkled over the spilled mercury. Then the powder should be dampened with water. The mercury will then react with the powder, forming a metal mercury amalgam that can then be swept or sponged up. Employers should try to take measures to prevent the spill in the first place by replacing mercury-filled glass thermometers and mercury-filled devices used for measuring blood pressure. Make sure that spills are cleaned up promptly and safely by workers or a team trained in proper procedures. Periodically train employees to understand procedures and to correctly follow policies, such as procedures in place that provide for isolation of the contaminated area. Have spill kits available to help clean up small spills of 25 milliliters or less. When the MSDS says that the eyes should be flushed if the chemical splashes into an employee's eyes, the facility is required to have an eye wash station available and placed so that the worker can reach it within 10 seconds. The flow must remain on without the use of hands. The unit should be located on the same floor as the hazard, and the path of travel should not be obstructed. Each eye wash location should be identified with a highly visible sign. The area around the eye wash should be well lighted. Maintain the eye wash according to manufacturer's instructions. Plumbed units should be activated weekly to verify operation. All units should be inspected annually. Every worker dealing with hazardous chemicals should know where the eye wash station is located and how to operate it correctly. A medical record created in connection with a hazardous chemical exposure or drug exposure should be kept for the duration of employment plus 30 years. Many states have their own regulations, which could be more stringent than those of OSHA. Your safety officer can contact the appropriate agency to learn of any additional requirements. Employees have a need and a right to know the hazards of chemicals and drugs they work with, how to read labels and material safety data sheets, the proper personal protective equipment to wear when working with a hazardous chemical or drug, how to properly dispose of hazardous PPE, how to handle a leak or spill, how to be prepared to handle an employee exposure situation.
Using the information that we gathered from the last meeting that we had.
Hazard communication is an ongoing program, not a one-time effort. In order to have a successful program, the safety officer must provide initial and ongoing training to employees.